Hi, I'm Donna Cansfield. I'm the former member for Etobicoke Centre for the Ontario Provincial Legislature, and I have the pleasure today of saying hi to Yvan Baker and asking him some questions, and we're going to concentrate today on health care. I also would like to say thank you first to Rogers. What they're doing in allowing this taping to occur and then showing it is absolutely superb. So thank you, Rogers, for your continued interest in helping us get our message out. So Yvan Baker is our new member in Etobicoke Centre. He's been doing an absolutely superb job. You know, it's such a pleasure for me, having worked with Yvan, to know that you're in good hands. And so, hi Yvan, how are you?
And thank you for saying that, Donna.
Well,
It means a lot.
it's just so true. I am tickled pink, as they might say.
Thank you.
We're going to talk, though, about elder care, patients first. And this is really important because you bring to this particular subject huge financial background. You speak about the obligations around financial fiscal responsibility. And as you know, this is a $52 billion budget in health care. And yet, elder care is just as important to someone who is a senior like I am as it is to their children who care for their seniors, or their grandchildren who see their grandparents with dementia or Alzheimer's. So it's an everybody issue. It's not just a seniors issue. So let's talk a little bit about Patients First. Tell us about it.
Sure. So Patients First is a piece of legislation. It's an initiative of the provincial government to really reform healthcare in a number of ways. And maybe I'll mention just a couple of highlights for now. One of them is, one of the things that we discovered, and this is one of the things that I think about a lot, given my finance and business background, is how we spend money in the healthcare system. And one of the things that we've discovered is that a lot of money is being invested. You said $52 billion. A good portion of that's going towards community care, or what many of the viewers would know as CCAC care. But we discovered that not enough of the money was flowing to the front line. In other words, not enough of the money was being used to provide services to people. And so one of the things that Patients First does is it takes the CCACs, which are the ones that provide the care to people, and it merges them with the LHINs. And the LHINs are local health integration networks. They're responsible for care in each region of the province, and they fund the CCACs. So by collapsing them, we're going to be able to eliminate some of the administrative costs, some of the duplication between those two bodies, and that will allow us to put a little bit more money towards frontline care. So that's one thing that's important. Another thing in Patients First that I think is important is that we're trying to link the community care and the LHINs with your primary care doctor, with your family doctor. You know, a lot of folks will get care through a hospital, through community care, and their doctor may not know about it. And how is that possible if your doctor is really the primary person who most people turn to kind of shepherd their care and make sure you're getting the right care? So to avoid duplication, but also to make sure we're coordinating care effectively, we're linking those things together. So those are two elements of the Patients First initiative that I think are positive steps. And but I'm most excited and optimistic about being able to flow more money to the front line so people can get more care. Because what I hear consistently in the constituency is, you know, thank you, I get 2 baths a week, but I need much more than that, or my mother or my dad need much more than that, and we need to do better in that regard.
Or thank you, I get no baths.
Or exactly.
Because one of the challenges you have, and if anybody can identify, it's you can, because you have 4 local integrated health networks and 4 community care access that are in your particular riding. And we both know that the standard of care is not the same everywhere. Do you actually think Patients First will work towards providing a standard of care that's similar in all parts of your constituency?
That's Eric Hoskins is committed to working towards that. He's the Minister of Health, is working towards consistent care. But that's easier said than done. And I think that that's something that, Donna, I know you worked on very hard when you were MPP, is this issue of around the inconsistency of care in our community, and something I've worked on very hard. One of the things that I've met with Eric Hoskins on a lot is how we can address that issue. It'll take time to make sure that we can have consistent care across the province. But in our community, as you said, we have 4 LHINs. Our community is divided into 4 regions. And so in each of those 4 regions, there's different funding and different priorities, and so people get different care. Some people get 3 baths a week, some people get none, for example. And so one of the things I've been advocating for, meeting with Eric Hoskins on, is how can we ensure consistency? And one of the things that I've been trying to do is figure out, can we adjust those LIN boundaries, those boundaries that divide up our community, can we adjust them so that everyone in our community who pays similar taxes, who lives a similar quality of life, can enjoy similar care. So I'm working on that very hard as well.
Good. That's good to hear, because one of the things is that I think it's every 5-6 minutes in Canada somebody turns 65. And so as we age and we're living longer, because we do have some good health care, dementia and Alzheimer's disease is a serious challenge in our communities. And again, I do not know anybody that doesn't have someone touched or someone they know touched by Alzheimer's disease or dementia.
Yeah.
So what about a strategy? I mean, we've been trying to work on that for some time, and I know the feds are looking at it seriously, and now they're thinking about how they can do it. But what about us? What about the province of Ontario? What are we doing to help these folks?
Yeah. So, I mean, first of all, Donna, I'm going to take this opportunity to talk a little bit, just for a minute, and thank you for all the work that you've done on this. When you were MPP, you did a tremendous amount of work and advocacy on this issue, on seniors' care in general, but particularly on caring for those who are struggling with Alzheimer's and dementia, particularly in the context of long-term care homes, but also more broadly. So you've been one of the champions of this. I just get to pick up the baton and help run with it.
For picking it up.
But I think so. So I've been advocating for a dementia strategy, and for me that means a number of things. It means that we provide the right supports to those who need the care, the right supports. But it also means that we provide the right supports to those people who are caring for those who are struggling with Alzheimer's and dementia. Donna, you'll remember it was almost 2 years ago now that you kindly hosted a consultation with me at Etobicoke Collegiate about Alzheimer's and dementia and what that dementia strategy should look like. And I remember hearing from not only those, we heard from a lot of the caregivers, the family members who were caring for those with Alzheimer's and dementia, and how they needed relief as well. So I've been advocating for that. I know Eric Hoskins, who's our Minister of Health, has committed to a dementia strategy. As always, the devil's in the details, and so I'll be pushing him to make sure that we put the right funding behind it, but that also we have the right initiatives to make sure that it tangibly helps those who are struggling, not just those who are struggling with Alzheimer's themselves or dementia, but also the caregivers who need our support.
It's interesting. I was watching Marketplace the other day, and they did a very significant show on the long-term care homes and the potential. They're looking for a lawsuit against Rivera, I believe. But the challenge there is they're not building any more long-term care, and yet our numbers are increasing. And the whole idea is, how do we keep folks at home, and how do we provide the right services to support them? So let's talk a little bit about what you see happening in terms of that transition. And maybe also let's talk a little bit, how does palliative care or end-of-life care play into, because you're very supportive of the Dorothy Lay Hospice, and I thank you for that, but how can that hospice help, or palliative care help, in terms of long-term care?
Yeah. So in terms of, there's several elements to what you said. I mean, the first element is around making sure if we're not going to be building as many long-term care beds as maybe we have in the past, then we need to make sure that the community care options are excellent, that they support people. That's because that's going to be the alternative for a lot of people. And so one element of that to me is making sure that we're significantly growing the amount of funding that we provide to community care. It's easy to say, yes, we're not going to provide long-term care beds, deal with community care, but if you can't get the support you need from the CCAC, that's not right. So that's one piece of it. You talked about palliative care, and that's another area that again, you've been a champion of for so long, and you were a champion of Dorothy Lay long before I was able to come along and do some work in support of them. But Dorothy Lay is really essential for folks in terms of end of life and providing the supports to the family and to the patients at a time at this most difficult time. And we need to provide more funding and more supports and the right kind of funding for the right kind of services, not just in what I would call in a structured setting, but also in the community. So that's a really important piece of that, and I know Dorothy Lay is doing a lot of work in that area as well.
It's certainly, and I actually did hear from Eric speak to recently how do we continue to support in the community and what difference that can actually make. But it also, $52 billion is a lot of money. And if we don't do something with our health care, and that's your financial background, that's what you bring to the table that's to me so important, we cannot sustain it. And yet we know our numbers are growing. So what you're doing and how you're approaching and looking at the fiscal responsibility as well as the humanitarian part of it is so important in terms of balance. But it's really important to let people know that yes, the money will be spent, but it will be spent well. So, tell us about how you do your approaches in terms of that.
Yeah. So there's a couple of things. I mean, since I've been elected, I've sat on a body called Treasury Board, which is the committee of cabinet, and I know you sat on it as well, that oversees how government allocates and spends money. And so I've tried to lend my expertise to that. That's across all ministries, but health being our biggest ministry, I've spent a lot of time on health. And so in terms of, you're absolutely right, it's not good enough for us to say we're spending 3% or 5% or 10% more in this area. We need to show how that money is delivering better outcomes. So I'm trying to make sure that we're measuring the outcomes that we're delivering for people. It's not good enough to dump money at it. Are we making care better for people in the community? And then making sure we're investing in those areas that are working, holding people accountable too. I think it's really important. The healthcare system is really big. There's a lot of people involved. I know everybody wants to do the right thing. That's where everybody's hearts are in the right place. But we need to make sure that we're thoughtful about making sure that the entire system is efficient and that people are all working really hard to make sure every healthcare dollar possible goes to the front line and to care for people. So that's at a high level what I'm trying to do.
Listen, that's great. Yeah. I mean, we're almost out of time. It's such a complex subject, talking about healthcare. It's so important that you're on top of this, Yvan, because it is important to your community, and it's nice to hear that you're looking at it from both perspectives, the fiscal as well as managing the money, but also providing care in the right places at the right time for the right people. So thank you, and thank all of you for sharing with us today. And if you do have any questions, please just do call Yvan's office, and I'm going to give you the number, 416-234-2800. Certainly he's there to support you, to provide those answers for you, and to ensure that you get the very best possible service, which I know he does each and every day with that wonderful staff of his. So again, thank you for joining us.